Hello students, this is your teacher and editor of this immensely beneficial book for you, that is ENT for entrance exams. Well, today I'll be discussing four important questions with you. Question number one, the risk of developing diabetic nephropathy is more in. So what do you think? The answer? Well, I can guess most of you are saying choice B. No, this is a wrong answer. Hmm? The right answer is type 1 diabetes. Right? So please remember that risk of developing diabetic nephropathy is more in type 1 diabetes. Right? And how much is this risk basically? It is 40% vis-a-vis 20%. So you should remember that risk of developing diabetic nephropathy is double in type 1 diabetes as compared to type 2 diabetes. Now, why is it so? The explanation is simple. If you recall from our previous discussions, we discussed that this diabetic nephropathy is a long-standing complication, right? And therefore, it happens more in type 1 diabetic patients because type 1 diabetic patients, if you recall, are young patients. We discussed in the previous video that the most common age group for type 1 diabetes to occur is preschool children to pubertal age, right? So since type 1 diabetes happens early in life, so therefore, this natural age of the patient is left for this long standing complication to happen, right? So please remember that risk of developing diabetic nephropathy is double in type 1 diabetes for the simple reason that type 1 diabetes sets in very early in the life, and therefore this long-term complication can easily set in, right? Suppose if this question is asked that most common cause of CKD, then you need to mark the answer as type 2 diabetes, right? So why type 2 diabetes is the answer now? Because we all know that 90% of the diabetes we see in clinical practice is type 2 diabetes, right? So though the risk of developing diabetic nephropathy in type 2 diabetes is half, as compared to type 1 diabetes, but since majority of patients are ultimately suffering from type 2 diabetes, therefore the most common cause of CKD in the world is type 2 diabetes mellitus, right? So what are these risk factors for developing diabetic nephropathy, right? This may be a short note question asked in your university exams, final university exams or final profs. So we divide these risk factors for developing diabetic nephropathy into modifiable and unmodifiable. The modifiable risk factors are five in number. Two we are already aware, if you recall, as per the previous discussions we have done, albuminuria is a risk factor to develop diabetic nephropathy. We understand that albuminuria is not only a risk to kidney damage but also to develop, yes, you are right, coronary artery disease. We have done this. And next important modifiable, and if you recall, what is the drug of choice to control this albuminuria? Absolutely. So you use either ACE inhibitors or angiotensin receptor blockers, right? Now, the next important modifiable risk factor is uncontrolled diabetes mellitus. So if the glucose, remains high in these patients, then there is a risk to develop diabetic nephropathy. So uncontrolled diabetes, we all know. And the three other risk factors can be easily thought of. Suppose, your diabetic patient is simultaneously suffering from hypertension also, then, hypertension will additionally lead to damage to the kidneys, right? If you recall my first discussion with you, first video, we discussed hypertension is the second most common cause of CKD worldwide. Similarly, dyslipidemia right? If you recall, dyslipidemia in diabetic patients is particularly common. I have spoken previously also that, even if the bad cholesterol levels are normal in a diabetic patient, this LDL or the bad cholesterol molecule is a dense type of molecule in a diabetic patient, and therefore it is highly atherogenic. And atherosclerosis in the kidney, mainly the renal arterial stenosis, will then further damage the kidneys. And lastly, smoking, right? So smoking leads to so many issues in the human body, and additionally this causes damage to the kidney as well. So we have these five modifiable risk factors for developing diabetic nephropathy, right? So what are the unmodifiable risk factors? Unmodifiable risk factors are: one, we have already done, duration of the diabetes. Duration of the diabetes, and it is in this regard you need to remember that the risk of developing diabetic nephropathy is more in, so don't commit a mistake now, it is type 1 diabetes. So always remember, right? So duration of diabetes. Then another is genetic predisposition. Genetic predisposition to develop diabetic nephropathy. So don't get confused. I'm not writing genetic predisposition to develop diabetes. We all know it is more in type 2 diabetes. I'm talking genetic predisposition to develop diabetic nephropathy, right? And one very important unmodifiable risk factor for developing diabetic nephropathy is retinopathy, right? So if your diabetic patient has developed retinopathy, then it is a very strong risk factor to develop diabetic nephropathy also, right? So this is something very, very important. So three unmodifiable factors. What all we have done: duration of diabetes, so therefore type 1 diabetic patients have more risk; genetic predisposition to develop diabetic nephropathy; and retinopathy, right? So what is the clinical significance? What is the clinical significance? Why retinopathy as an unmodifiable risk factor for developing diabetic nephropathy, right? Now, see, diabetes is such a common condition, right? Uh, 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 India, we all know, is going to be the capital of diabetes very soon. And suppose a diabetic patient comes to you, and you are detecting a kidney disease in your diabetic patient. Then you cannot, always say that this patient is suffering from diabetic nephropathy. No. I mean, it may happen that in a diabetic patient, the kidney disease may develop due to some other pathology and not diabetic nephropathy, right? So in clinical practice, how do we say that no, this diabetic patient having this kidney involvement is because of the diabetic nephropathy? So we advise the patient to get his fundus examination done, right? And if on fundus examination, suppose the ophthalmologist say that he is having proliferative diabetic retinopathy changes, then you'll say that yes, diabetic nephropathy is because of the this patient's having kidney disease as diabetic nephropathy only. And suppose if the ophthalmologist say that no, he couldn't find any retinopathy changes, then know we are not dealing with diabetic nephropathy. It is some other kidney ailment in this diabetic patient, right? So one last question I would like to ask you is that okay. So one last question I would like to ask you is that which microvascular complication occurs first, right? Is it diabetic retinopathy, or is it diabetic nephropathy? So yes, you're right. The answer is diabetic retinopathy occurs first, and then occurs diabetic nephropathy, right? And easily you can remember, first letter has R in it, and diabetic retinopathy. So diabetic retinopathy develops first, and secondly, secondly, this N, we have this development of diabetic nephropathy. So this is very, very important to know that in a diabetic patient, both these microvascular complications, if you recall, we know that they typically happen, after 5 years after diagnosis of type 1 diabetes mellitus, and we need to screen a type 1 diabetic patient for diabetic retinopathy and nephropathy after 5 years of making the diagnosis, whereas we screen these microvascular illnesses at the very beginning in type 2 diabetic patients, right? But then diabetic retinopathy develops first and then nephropathy. In fact, retinopathy is a unmodifiable risk factor to develop diabetic nephropathy, right? So that's all. So I hope you have learned some few important questions again, and do read the ENT for entrance exam. So thank you.